worried about your epidural wearing off during your labor? Have you heard some scary stories? I'm Dula Terry. I've been a birth doula in New York City for more than 20 years now. I have tips on pregnancy and birth. Please give me a follow. Find me on the other socials. Getting comfortable in epidural and then having pain come through and what might be happening. One of the most popular reasons for that happening is simply that you've been in a posture and gravity has moved more of the medicine to, say, one side of the body than the other. So let's say you had a nice nap, which I hope you do when you get your epidural, and you're laying on your side, which I also hope you do because I don't want you on your back. It is normal for more medicine to go with gravity and go to the side towards the bed, right? Which means that upper hip might start to have pain. So the solution there, as long as baby is happy, you're just gonna flip to another position, push the button, and let the medicine flood that side. And that often is the problem. Second thing that can happen is things have just progressed. As your labor increases, that base dose or that base dose plus the button pushing may not cover your pain. And you may need to call back anesthesia and ask for what's called a top off, where they give you a little more concentrated injection into the tube that you already have in place. Or maybe it's time to meet your baby, and that's awesome too. Just make some noise. Another important thing to know about pain with epidurals is you don't want to ignore it. You don't want to let it build. If it's starting to be like, wow, now I'm starting to have pain, that's when we want to address it. The sooner we address pain when we're using medication to help, the less medication we tend to need. If we wait for it to explode, the pain gets very strong, you're going to need a lot more meds, which is going to create a lot more numbness. If you're starting to feel these breakthrough pains for any reason, call in the nurse, call in the staff, and talk with them about it and troubleshoot, because those are the common problems that would happen. They're pretty quickly fixed. Sometimes, sure, epidural, does it stop working? What I've seen is like the tube becomes disconnected or it does pull out of the back. So something like that could happen. And that would be, again, troubleshooting because I'm having pain. As soon as that pain is starting to come back, things are changing, call the staff and let them help you troubleshoot. It is a continuous dose. It does not wear off all of a sudden. You can turn off an epidural, and for most people it's going to take a while before they're going to feel full pain. That doesn't mean that you wouldn't feel sensation, and we sometimes turn down epidurals for pushing for that reason. But in general, when you're having breakthrough pain, it is usually fairly quick to address and does not need a full replacement of your epidural.